Hello everyone. Good day, good morning, good afternoon, depending on where you are. This session is going to be on towards developing an evidence architecture for elder abuse. And I'll say a little bit about the background to this in my presentation that's coming up. But what I'll do here is just introduce the 5 panelists. I'll start with myself very briefly. My name is Christopher Mikton. I work at the World Health Organization in the Demographic Change and Healthy Aging Unit, where I'm responsible for elder abuse, among other things. I'll hand over to the next panelist who's on my left on the screen, and that's Jieyun. And then maybe you can, afterwards, we'll have Fiona come introduce herself. So Yonggjie, please, go ahead.
Hi, good morning, good afternoon, and good evening, everybody. Thank you very much for joining. My name is Jieyun. I, like Chris, work for the World Health Organization's Regional Office for Europe. We're based in Copenhagen, Denmark. And I work in the area of health policy. And elder abuse prevention is a great interest of mine. I see Fiona on my screen, so I'll pass it to Fiona for your introduction.
Hi and welcome to the panel. My name's Fiona Campbell. I'm a research fellow based at the University of Sheffield. I'm also an editor on the Child and Adolescent Wellbeing Group, the Campbell Collaboration. My interest is in supporting the development of the evidence gap map and mapping review for this project.
And our chair, who had some trouble connecting, has just arrived, Bridget Penhale. And I'll let her take over maybe once we finish the introductions, the 2 more introductions. Marie, next, thank you.
Yes, hello everyone. My name is Marie Beaulieu. I'm from University of Sherbrooke in Quebec, Canada. I'm a chair-holder of a research chair on mistreatment of older adults, and I'm also a co-director of a WHO collaborative research center where we're looking at age-friendly communities and elder abuse.
Okay, thank you, Marie. And the last panelist is Jieyun Li from the University of Lanzhou in China. Jieyun.
Hi, everyone. My name is Jieyun Li from the Center of Evidence-Based Medicine and Social Science of Lanzhou University. As I am still a graduate student, and it is a great honor for me to be here. Yeah, that's all. Thanks.
Thank you, Jieyun. Now I'll hand over to Bridget, who's our panelist, and maybe she can introduce herself and then do the chair.
Good afternoon, everybody. I hope very much you can hear me. I could see and hear you, but I couldn't get access somehow. So very many apologies. I'm glad to be here. I'm speaking from the UK, and I hold an honorary position at the University of East Anglia, which is in the eastern part of England in Norwich. I'm delighted to be here as the moderator, after a fashion, the chair for this session. I'd like, without further ado, because I know we had some delay, to hand over to Chris Mikton and to ask him to make his presentation about evidence architectures. Thank you, Chris.
You're welcome. Let me just get the thing going. Can you see my presentation?
Yes.
Yeah. Okay, good. So yeah, before my colleagues tell you about the mega map on elder abuse we are developing, I'll say a few words about why and how we've gone about developing an evidence architecture for elder abuse. Has it shifted to the next slide? Yeah, now it has. Right? Yeah. Okay. Before I do that, I'll just give you a few key facts about elder abuse, especially for all those who don't really know much about this topic. And I'll be very brief here. Elder abuse is defined as a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust, which can cause harm or distress to an older person. And it can occur either in the community or in institutional settings, long-term care institutions, nursing homes, and so forth. And the main types of elder abuse that are generally recognized include physical abuse, psychological and emotional abuse, sexual abuse, financial exploitation, as well as neglect, and sometimes abandonment is also included in this. WHO estimates that about 1 in 6 older people worldwide have been abused in the past year. And rates in institutional settings are even higher than that. And there's increasing evidence that elder abuse has increased during the COVID-19 pandemic. Elder abuse has many very serious, sometimes devastating consequences, including physical effects, psychological effects, social effects, like people having to be put in institutions. And many different strategies have been tried to prevent and respond to elder abuse, but at the moment, very few of them are supported by high quality evaluations. So that's a quick overview of elder abuse. The main reason we are developing this evidence architecture for elder abuse at this point is that WHO, after addressing elder abuse only very sporadically in the last 20 years, has decided to tackle it in a more sustained way within the UN Decade of Healthy Aging. This decade goes from 2021 to 2030. And for those of you who are unfamiliar with it, what the decade aims to do is bring together actors from many different sectors for 10 years of concerted action to improve the lives of older people, their families, and the communities in which they live. You can get more information on this, the link here on the slide. And within the decade, elder abuse is increasingly recognized as an important topic. And we're in the process of trying to develop a strategy to address elder abuse throughout the rest of the decade. And even though the strategy is still under development, we think it'll have to do at least 2 things. One is increase the global priority of elder abuse, and the other is build up an evidence architecture for elder abuse. And to inform the development of this strategy, we've done and are doing 2 things. One is we undertook a research project which investigated the factors behind what's generally recognized as the inadequate priority of elder abuse. And that's pretty much finished. We were just about to submit the paper. And the other project we undertook to inform this strategy is the development of what's called the mega map, and I'll say more about this in a minute, to try to map what evidence is available and where the gaps are. The notion of evidence architecture comes from a paper that Howard White, who I think spoke in one of the plenary sessions, that Howard wrote in 2019. And he sees the evidence architecture as one of the major ways of institutionalizing the use of evidence in policy and in practice. And evidence architecture is made up of 2 major components. One is kind of the supply side, the supply of evidence, and that goes from raw data to primary studies, and then to a whole series of different evidence synthesis products, including systematic reviews, evidence platform, evidence maps, and things like guidelines and checklists. However, the supply side is not enough. You also need to, the demand side. The demand side really tries to stimulate and channel the demand for evidence, and it's really at the heart of institutionalizing the use of evidence in policy and practice. And strategies used to kind of stimulate this demand include the use of evidence workshops for communities of users, things like evidence-based budgets, and so forth. And we decided that we would start here in this evidence architecture with the development of evidence maps to, as I said, inform the strategy to address elder abuse, but also as a first step towards building the evidence architecture. And we have then the intention to contribute other components to this evidence architecture, most likely an evidence platform. And this is a little bit further down the line. The evidence map we're working on, it's a mega map, and I'll explain what that is in just a second. And it's going to cover all aspects of elder abuse, not only interventions to prevent, detect, and respond to elder abuse, but also the prevalence of elder abuse, the consequences of elder abuse, and risk and protective factors. And our colleagues in Lanzhou University are themselves doing an evidence and gap map, which will complement our mega map. So what is an evidence and gap map, and what's the difference between an evidence and gap map and a mega map? Well, an evidence and gap map is a systematic evidence synthesis product that displays the available evidence relevant to a specific research question. And it provides a visual and interactive display of the existing evidence, which is updated on a regular basis. It says what evidence there is. It doesn't show what the evidence says. So it doesn't provide a synthesis of findings like you find in systematic reviews. It just describes what kind of studies are available. And an evidence gap map is primarily based on primary studies as well as systematic reviews to an extent, while a mega map is not based on primary studies. It's exclusively based on systematic reviews and other maps. That's the difference. Mega maps based on systematic reviews and other maps, evidence and gap maps primarily based on primary studies. These maps serve at least 4 purposes. One is to increase the discoverability and the use of evidence, mainly or importantly by decision makers and policymakers. Second is to guide implementing agencies away from interventions without evidence and towards those with evidence. Third is to help produce higher level evidence synthesis products. In that pyramid you saw a few minutes ago, the higher level products were things like guidelines and checklists and evidence portals as well. And these are more likely to be used by decision makers and policymakers. And the fourth purpose is to identify research gaps and then try to commission research to fill these gaps in a more coordinated and more strategic way. This is an example of an evidence and gap map. This one's on interventions for reducing violence against children in low and middle income countries. It includes 97 primary studies and 55 reviews. The link is there if you're interested. And I'm just going to highlight 4 features of this map. The first one is that interventions, and this one's only on interventions, are listed here in the rows. And I don't know if you can make out the very small print, but there are interventions such as laws, media campaigns, bystander interventions. In the rows, you have the outcomes which the interventions are seeking to affect. And this includes, in this case, things like physical violence, psychological abuse, sexual abuse. And here, in this cell, for example, this is the cell that deals with evidence about laws to prevent physical abuse. Third feature is that you have these circles which indicate the amount and the quality of evidence. In the cell that's pointed out here, you see that there's quite a large red circle. That means that there are quite a few systematic reviews, but they're of low and medium quality. On the cell just above, the little green one, is you have fewer systematic reviews of higher quality, but lots of lower quality. And the last feature, yeah?
Chris, can I ask you to speed up a little bit, please?
Sure, I'm almost finished. Just one more slide after this. And you can also then have these filters where you select evidence according to different variables, like the countries, if you're interested in studies from particular countries or region, and so forth. And the last slide, this is a draft of our mega map on elder abuse. And you see that in the rows, you not only have interventions, which are further down, but you have the other aspects of elder abuse, such as prevalence and consequences, and the outcomes we're looking at across all 4 aspects: prevalence, consequences and so forth are different subtypes of abuse. Physical abuse, psychological abuse, sexual abuse, and so forth. And now I'll hand over to my colleague Marie, and I'll stop sharing. There we are.
Thank you, Chris. And Marie, the floor is yours.
Thank you. Do you see my presentation? You see it?
No.
No.
Thank you. No? Okay. Good. I'm a little concerned because it says that my screen is shared.
Oh.
Okay. Paramètres d'affichage. If I change the slide, it doesn't show either.
No.
Can you imagine?
Marie, let me share the screen to see if everyone can see it. And then you can tell me to switch. Just give me a moment.
I'm very sorry. It worked as a pretext just 10 minutes before the session. Thank you so much, Yongjie. So in my presentation, I would like to tell you a little bit of the history of this project. And actually, it started on my side from a scientific watch to a mega map. So we really wanted to do some expanding on knowledge transfer. Next slide, please. As I said earlier, I'm a chairholder of a research chair on mistreatment of older adults. This chair is funded by the Quebec government. It's part of a plan of action to counter elder abuse. And this chair is located at the University of Sherbrooke, more specifically at the Research Center on Aging. And this research center, a part of it is actually the collaborative research center with WHO. Next slide, please. In my team, we are a group. I'm the principal investigator, and with me are working Julien Cadieux-Jeunesse and also Kevin Saint-Martin. But we have also a colleague, my co-PI is Amanda Fillon from Dublin, and she has a postdoc student, which is Mark Byrne. And we have the pleasure of having a PhD student from USC, so University of South California, working with us, which is Kelly Mansbelt. Next slide, please. A brief overview of my 6-7 minutes to come. I'm just going to tell you a little bit more about the research chair, the scientific watch that we've been doing, why we decided to go into a mega map, and a brief overview of the two teams that we will be exploring. Next slide, please. Next, please. So in Quebec, there's a plan of action that was adopted first in 2010. That's a government plan of action. So it shows here that it's a government priority. And there were 20 million Canadian dollars involved in this plan of action. And one of the 4 structuring measures was the creation of a research chair. So I have a mandate to work closely with practitioners, with seniors association, and for sure with the government, because they want to have policies that are more and more evidence-based. This plan of action was renewed in 2017, and it's still in force until next year, 2022. And there's already the writing of a 3rd plan of action where we are already assured that there will still be a research chair. So according to the International Network for Prevention of Elder Abuse, this is known as being the only research chair on mistreatment of older adults in the world. Next slide, please. The goal of the chair is to expand knowledge to better understand and counter the mistreatment of older adults. And we are having 4 main objectives. First of all, to do research, no surprise. So it can be theoretical research, empirical, practical, and also evaluative research. We do a lot of outreach, so that's knowledge dissemination, so conferences and sessions like today. We also do, whoops, next slide, please. We also do some training of the practitioners and also at university at all level of teaching. And oops, Yongjie, it went wrong. Yes, thank you. And finally, we do some knowledge transfer. And one of the ways of doing the knowledge transfer is actually to have a website where we've been putting a lot of information, and we're doing a scientific watch. So next slide, please. So next slide. Yeah. So the method we've been using to do that scientific watch that we started 10 years ago is we have a standardized ways of doing it, looking at different data banks with keywords, and we do it twice a year to update the scientific watch. So in January and also in July, we're looking at international publication, which are mainly primary researches and also some reviews published since 2007. And we place on our website the reference, the abstract, and the links when it's open access. Next slide, please. We're looking at 51 teams. So ageism, caregivers, consequences. So it's several teams that are related directly or indirectly to elder abuse. And one of the things that we realize is that year by year, there's an increasing number of meta-analysis and systematic reviews. On date of yesterday, we have 82 in our scientific watch. Next slide, please. Next. So 2 years ago, almost 2 years ago, we started a discussion with Chris Mikton and also with Yongjie at one point of the WHO. And we just thought, what could we do with this material? Because we were doing summaries, we were doing some type of dissemination, but we said there's a need for an appraisal and also dissemination of the knowledge. And that's why we decided that we would want to go for a mega map. So we really wanted to build on the evidence. And we know that not in short term, but at midterm, this will help for researchers, government policymakers, but like what Chris was saying, also practitioners. And I always hope that this type of information may be in some way directly used by older adults. Next slide, please. So my team is doing a brief overview of 2 teams. Actually, I'm going to really introduce you very briefly. The first one, we're looking at the prevalence of elder abuse for people age 60 plus who have experienced abuse in a given time period. Many studies are looking at the past 12 months, but others are looking at 3 months, others are looking at longer. We want to have some material coming from the community, but also from institution and institutional care settings. Next slide, please. The other part that we really want to look at is what do we know about intervention? And there's 3 types of intervention that we are analyzing. The first one is prevention. The second one is detection. But the third one is the response. And what is quite interesting is that we really aim to look at the response, not only for older person who went through abuse, but also is there any strong material regarding what we do as a response with people who have been abusing older persons. Next slide, please. So I really wish to thank you. It's a very brief overview, and I want to invite you to look at our website, which was on the slide. Actually, it's a website where we put some material in free access, both in French and in English. Thank you very much.
Thank you, Marie. I'd now like to invite Jieyun Li to make her presentation about the gap map on interventions. Thank you, Jieyun.
Okay, thanks. Could you see my presentations now?
Not yet.
Not yet. Okay, hold on, please. And now, could you?
Yes.
Okay. Good. Hi, everyone. In my presentation, I'm going to do a broad introduce of our intervention evidence gap map for detection, prevention, and the response to elder abuse and neglect. And its relevance to the map, as Chris said before, our project across the path with the map. And as there are many countries adopt and much research assesses various solutions to elder abuse and neglect, but the quality of evidence on the effectiveness of these interventions, detail the specific population settings or something are all unclear. So our Lanzhou team decided to do something about them and present these evidence in a gap map. WHO has a plan of health agent, which aims to improve the quality of life of older populations by implementing evidence-based actions that optimize their opportunities for health participation and safety. And this coincident with what we are doing. But noticeably, unlike the map consists with 4 components, this evidence gap map is only focused on effectiveness study of interventions. And as the table shows, except for the study design, we included gap map and the interventions component of map are almost with the same population, intervention and outcome. The map only include reviews, but our evidence gap map included both primary studies and the reviews. In addition to the experimental studies, we also included the non-experimental studies with comparison group. And here is 2 objectives of this evidence gap map. The first is to develop a clear classification of elder abuse interventions and outcomes.
Your slides aren't moving
so
forward.
We set up frameworks for the interventions and the outcomes. As you can see, each interventions category has a number of subcategories, which are based on the applied coding, expert advice, and the discussion with team and the advisory members. The most outcomes are population's knowledge and attitude of abuse, such as knowledge of laws or rights, mental health, and the prevalence of abuse.
Jieyun, we can't see your slides moving. Are you able to do anything about that?
You can see it? Okay.
We started seeing them and then they froze, so they haven't been moving.
Hold on, please. You can see my screen now?
No.
Yes.
Can you see my presentations now?
Yes.
Yes, we can see that.
Okay. When did you can see it? The slide, which one?
Number 3.
So which slide should I start?
There, maybe.
Hello?
Yeah.
Hi, can you start at this slide that you're on now?
This one?
Yes, please.
Okay. This one. Hold on, please. Can you see it?
That's fine, thank you.
Sorry.
Just to say you have 2 minutes left.
Okay. So as you know, the map include only reviews, and our gap map include both reviews and primary studies. And this is 2. Okay. Okay, here we go. The second objective is to map existing eligible systematic reviews and primary studies, and provide an overview in the summary report, which is in order to be able to report comprehensively, we also access the availability of evidence across the additional filters, like regions and the income status of countries, the confidence in study findings. Since the studies, we included not only systematic reviews, which could embedded with WHO map, so we could share our reviews in Chinese and English with map teams and vice versa, and provide coding for reviews we find. And by yesterday, after developed and applied a search strategy, we searched the studies from database, gray literatures and international organizations. We have completed data coding of 56 eligibility literatures, and 47 were identified from primary studies and 9 from systematic reviews. And from 56 studies so far, the number of different categories mentioned, detection, prevention, and response, are fairly average, but high unevenly distributed across different income countries. The quality of research on interventions for different populations is generally low, and the quality of research on interventions for different types of elder abuse is also very low. Okay, thanks again to the chance to bring attention to these issues again, and thanks all for your attention. That's the end of my talk.
Thank you very much, Jieyun. I'd now like to invite Fiona Campbell to make her presentation. The floor is yours, Fiona.
刚刚秀了吗？啊？刚刚屏幕秀了吗？哦，对，刚刚屏幕稳不？
Can I check that you can see my slides?
Yes, that's fine. Thank you, Fiona.
Thank you very much. So I'm just presenting on behalf of the University of Kent team, and the team is led by Jennifer Story and Michaela Rogers. And this is really building on the work that Chris has described, and Marie. It's the work of the mega map. So this is where we're including existing systematic reviews, and we're looking across a range of domains. And the particular domains that we're focusing on in our team are the risk factors and protective factors for, and the consequences of elder abuse. So these two domains. So why are we interested in risk factors? Well, risk factors are very important because they tell us something about why elder abuse occurs. So, for example, substance abuse is a risk factor for elder abuse, and individuals who have substance abuse problems are more likely to engage in elder abuse. So knowing these factors can help focus interventions on reducing substance abuse among perpetrators, just for example. So we'll be able to reduce the likelihood of elder abuse in the future. So they're important factors to really understand in developing interventions and strategies for prevention. And in preparing for this mega map, we've explored using theory and stakeholder engagement and looking at the literature to identify what might be the factors that we include. And as Chris has already described, an evidence gap map, or in our case, a mega map, also shows not only what's there, but what isn't there. So we start with creating a structure, a matrix, if you like. And these are the different factors that we would be interested in seeing whether they've been addressed within the literature. So individual level factors that relate to the victim, for example, age group, gender, dependency, and then individual factors related to the perpetrator, and what features might be characteristics there. Relationship level factors. So, for example, what's the nature of the relationship between the elder person who's being abused and the abuser? Also looking at what might be community and societal level risk factors, and also characteristics of care institutions. So these are different types of factors that we're wanting to explore. What about consequences? Well, these tell us what victims need in order to recover from abuse and lead healthy lives and restore well-being. So, for example, a consequence of elder abuse is depression. Victim depression is also a risk factor for continued abuse. So, in order to address interventions on the mental health of victims will also decrease depression and hopefully reduce the likelihood of future abuse. So this is another reason why it's important that we consider consequences in the mega map. And these are some of the consequences that we've identified in this initial preparation of the matrix for the mega map. So service use, mortality, physical health symptoms, psychological mental health symptoms, social and economic consequences, and other consequences of elder abuse. And as Chris has already shown, this is the map, which isn't populated because our coding isn't finished, but it shows you along the top the column headings. We've got the types of abuse, and here it's just a snapshot from the map showing the risk and protective factors, which are row headings, and also further down the map the consequences. And this is all part of the overall map, which will also have interventions and prevalence within it. Just wanted to mention too the filters that we've created. So this will allow users of the map to interrogate it, to explore, for example, what are the quality of the reviews within the map, what's the nature of the synthesis that's been used in those systematic reviews. For example, is it a narrative review, a qualitative review, is it a mixed methods review or meta-analysis? It allows you to explore what is the type of abuse, what is the setting within which it has occurred, what is the source of the report, particularly for the work on prevalence, what are some of the victim characteristics and perpetrator characteristics, and also to look at region and country income levels. So these are, and conflicts of interest. These are all filters that will be built into the coding that will allow people looking at the map to search the map more specifically. Just also want to mention the tools that we're using. So we're doing this work within Epi Reviewer and using Epi Mapper to generate the map. And just also wanted to give a little mention of a course that we do in collaboration with the Epicenter at the University of Sheffield. It's an online course, so if anyone's really interested in this sort of methodology, wants to learn more about it, this is a short course that we offer. Thank you very much.
Thank you very much, Fiona. I'd now like to invite Yongjie to make his presentation. Fiona, could you turn your microphone off, please? Thank you. Yongjie is going to talk to us about process and challenges.
Yes, can everybody see my screen?
Yes, thank you.
Great. Good morning, good afternoon, good evening, everybody. Again, thank you so much for staying to the last session of the day. I'm very happy to share with you to talk about how we organize ourselves to create this MegaMap project, and talking about some of the processes and challenges. And as you have heard from our colleagues, we are quite a large group of 7 institutions and universities in many different countries and across 5 different time zones. And each of the teams work on different parts of this project. And so one of the challenge that we have is about how we can schedule the meetings among all of us, between groups and within groups, and working collaboratively. So the first challenge is scheduling across the 5 time zones. And we really like to thank our colleagues from different parts of the world working either very early in the morning or late in the evening to have all these meetings. As mentioned by colleagues, we are very interested in creating this global evidence architecture where we want to gather evidence from around the world, which means that we're not just looking at the English language, but across multiple language. And that's the added challenge in having the resource to be able to review extract articles in different language, like in Spanish and Mandarin, which we're very grateful for Lanzhou University to help us in navigating this Chinese articles, but we're also looking at Portuguese, Farsi, Germans, French, and many other language. Another challenge that we have is ambitious challenge. We set a very a time frame of within this year to complete this mega map project. And we find ourselves underestimating the time it takes to develop the protocol, to develop the search strategies and the inclusion-exclusion criteria, which is a very iterative process. To communication is so important, especially with such a large group of members and teams. And we have our monthly meeting with all of the team members of about 20, 25 people. And this is an opportunity for all of us to raise some of the issues and to make decisions, to set milestones and revise our timelines. And in addition to that, we have our regular team meetings where we work on a specific part of our project. But we also recognize that there are some cross-cutting issues that really affect the entire project. And we also know that it is very challenging to bring everybody together all the time. And so we developed some subgroup meetings with representatives from each of the teams where we focus on very specific part of the project. So for example, we have the librarians and information specialists, where we have a subgroup meetings to talk about the search strategy. We have another subgroup on protocol development, a subgroup that focus on screening of title and abstract and full text screening, where we've actually learned very much from Fiona from Sheffield University to learn about the EPI Reviewer on how to use EPI Reviewer to screen our articles, as well as refining the inclusion-exclusion criteria. And we also have a data extraction subgroup. And lastly, we have the stakeholder meetings because we want to have the buy-in of the stakeholders, the researchers, the academics, the practitioners, advocates, policymakers, so that they can use the mega map so that we can advance this issue forward. And so we convene an expert group virtual meeting earlier this year, and we will convene another stakeholder meeting at the end of this project. So we can discuss how we can use the evidence architecture and move forward. Here is just my last slide in terms of the best practices and lessons learned in coordinating this global project. Communication is very important, and we think that having established main point of contact with each team is really crucial to streamline our communication. We've also have so many meetings, and it is for each meeting we set up clear goals and agenda. And after each meeting, we have a summary of decision, clear action points for follow-up. We also recognize that there are a lot of emails, and we try to sort of use the email threads so that whoever wants to read or understand the background of the decision make or some other information, they could just scroll down in the emails and read about them rather than searching all of the different emails. And lastly is the flexibility of everyone, of calling each other, discussing, and being very willing to work and support one another, which is really a great way to build a stronger network as we move the field forward. And so these are some of the best practices, ongoing best practices of coordinating this global project. And we look forward to sharing the results with you. And if you're interested to find out more, please contact us. Thank you.
Thank you very much, Yongjie. Great way to wrap up and to have that final slide encouraging people to get in touch with you and to get in touch with the teams. I'm pleased to say that we have a few minutes now where we can have some questions, or we can aim for some discussion. Currently in the question and answer box, I don't see any questions from any of the audience, but if there are people in the audience who wish to ask a question, please type them into the Q&A function. But just by way of opening this part of the session, which is aimed at questions and discussion, I'm wondering if you could, if one of you would like to try and answer the question about how many good quality primary studies should there be before investing in evidence synthesis efforts. Anybody willing or able to take that question?
No one else is interested, I will.
Thank you, Chris.
So yeah, it's a difficult question, and I don't think there's any simple answer to this. But in relation to this evidence and gap map, I think it's most relevant to interventions, because we know that there are quite a few interventions, there are a good number of evaluations, but we know that most of them are low quality. And you wonder whether it's worthwhile undertaking these big evidence synthesis projects, be it a systematic review, an evidence gap map, whatever, meta-analysis, when you know that the results will be inconclusive. And I think you get that, in many different areas. There are lots of Cochrane reviews which basically say, well, sorry, low quality evidence, no conclusive recommendations, or no conclusive findings. So I think it's something that has to be borne in mind, and I suspect it may not be worth undertaking, especially these larger projects, unless there really are a good quantity of high quality studies. We're doing something similar. We're thinking of doing guidelines in another area, in social isolation and loneliness, and we're trying to decide whether there is enough evidence to justify the development of these guidelines. Guidelines are a long, complicated process. They cost hundreds of thousands of dollars. And if you come to the conclusion that, sorry, we don't really know, we can't recommend anything at this point, it's important to know that, but it's still a little bit disappointing. And maybe you have to postpone the development of these guidelines until a larger, relatively high quality database of studies is available. I don't know if anybody else wants to add anything.
Yeah. Can I add to that answer? And I'm going to give an answer that probably won't surprise you as a systematic reviewer, that my answer is 0. There is something still very valuable at undertaking a rigorous search to identify the fact that there is no evidence, because no evidence is still an important finding. In terms of, when we talk about evidence gap maps, one of the important things on that map are not just those cells which have studies in, and perhaps studies that indicate that a systematic review is necessary, but those cells that are also empty, because that's really important in terms of guiding where future research priorities and funding should go. So you can't necessarily say there is no evidence until you've undertaken a systematic review. Now, I know that an empty review isn't terribly useful, and sometimes actually I think maybe the challenge is looking to see if you haven't got any high quality evidence and a policymaker needs some evidence, is it better to see whether there is something that you can say with poorer quality evidence? So to me, there is always a place for a systematic review, even if the evidence may seem very poor.
Any other comments from other panelists on that particular point?
Maybe I could add just a tiny bit, was that what we're trying to create this evidence architecture is to sort of assess all of the primary studies that the Lanzhou University is doing, and also the systematic review, and to assess the qualities of those studies so that you can see, the different kinds of qualities of studies that are out there, which can inform the availability of research and on the qualities of those research. So it is a useful way to plan ahead, or as Fiona said, to set a research agenda on moving forward.
If I can just add one last thought on this, I think it definitely is important to know that there is no evidence or where the gaps lie. It's a matter of doing it in the most cost-effective way possible. If you do undertake some of these large projects that cost hundreds of thousands of dollars to find out there's nothing, it's not a satisfying answer, and maybe that same answer could have been provided by a much cheaper method, maybe just doing a systematic review, which still takes time and costs money.
I suppose the sort of linked, excuse me, the linked question to that, however, might be, and it comes back to your point about resources, Chris, would it be better to use those resources, particularly where you've got lots of resource input, in actually conducting some of those higher quality interventional studies? Yeah. And I suppose I'm seeking views on that sort of devil's advocate type question.
Well, I'll give my thought on this in relation to elder reviews. We know there have been, well, how many systematic reviews have we identified on interventions? There are quite a few. There's maybe a dozen, maybe a little bit less, depending on the quality of them. And all of them arrive at a very similar conclusion, that there is a real absence of high quality evaluations that allow us to make any recommendations about what kinds of interventions should be implemented. And it might well be better, we might be better advised investing in the development and testing of interventions rather than doing more systematic reviews, which are going to reach the same conclusion. I mean, even if you do a new systematic review 2-3 years, there might be a few more interventions, but maybe the conclusion is not going to change. And sometimes it seems that there are almost as many systematic reviews as primary studies. And that I don't think that's necessarily the best use of resources.
Thank you, Chris. Fiona, would you like to come in there?
Yeah, thank you. I mean, I think that many funders, certainly if they're going to be spending a lot of money on intervention, would expect there to be an up-to-date, relevant, systematic review anyway before they prepare to fund it. And if there isn't one there, that would be part of the funding. And I think, that systematic reviews are expensive, but if you know that it's unlikely to be a lot of evidence, so some initial looking at do some initial searching, I think it's still possible to perhaps do a relatively cheap systematic review in terms of just identifying there's nothing there, but there's still a place to have a systematic review underpinning any funding for an intervention.
Thank you. I'm wondering if you'd like to say something, Marie.
Yes, please, Bridget. Thank you very much. Regarding intervention, I think you're touching here a very important point, is the fact that usually interventions are paid by government or certain agencies, while research is not always funded through those means. And actually, we have to be able to plan at one point that there would be new intervention, working with researchers and really trying to evaluate all the way along. And we don't have a lot of those protocols. So what we are seeing is actually there's a lot of issues about research designs and the possibilities. That doesn't mean that there's no intervention in the field, because there's a lot of things going on in the field of elder abuse, but it's just not evaluated. So I think this is a major challenge.
Thank you. I guess one of the other points is about how we can get to a place where we're ensuring that those studies which are interventional actually do have a core component which is about evaluation, and that's perhaps a discussion for another day. But I think it's a very valid point. I'm looking at the time and conscious of the fact that we have, if technically, run out of time. I think we could have some discussion, although I note that unfortunately Jieyun has dropped off the platform. So unless there are further points to be made, I'd like to thank everybody for attending and for the session. Many apologies for the technical glitches that happened at the beginning. And we, as Yongjie said in his presentation, and I guess others did too, we look forward to being able to update you with the results of the evidence gap maps and the mega maps in due course. Thank you, everybody.
Thank you, Bridget. Thank you, everyone, for attending.
Thank you all. Bye-bye.
Bye.